Did you know TikTok is now one of the most popular places people go for health advice? Yep, not PubMed, not a nutrition textbook, TikTok. Now, I'll admit, I'm kind of new to TikTok myself, but once I saw how many folks were turning 15-second clips into full-blown wellness doctrines, I knew I had to weigh in. Some of these hacks, surprisingly smart. Others, let's just say I'd rather you eat a gas station hot dog. So today, we're diving into TikTok health hacks. What works, what's nonsense, and what might actually be harmful. And I'll walk you through it all as a doctor trained in nutrition, functional medicine, and obesity medicine, with a healthy dose of science and a whole lot of common sense. Let's be real. TikTok isn't popular because it's slow and subtle. It's quick, emotional, and flashy. That's why so many health hacks go viral. They're based on speed. Everyone wants results yesterday. Simplicity. If it rhymes or fits in a 7-second soundbite, even better. Visuals. A dramatic before and after is way more convincing than a peer-reviewed study. And virality. But virality doesn't equal validity. That's where I come in, to help you sort through what's helpful, what's hype, and what might harm you in the long run. Let's start with TikTok hacks that actually work. Number 1, cold showers. A bunch of TikTokers are swearing by cold showers. And as strange as it sounds, they're onto something. Cold exposure helps activate brown fat, improve circulation, and reduce inflammation. I tried it a couple of months ago and haven't stopped since. Yes, it's uncomfortable at first, but over time it became a powerful part of my morning routine. It's hard, but if you stick with it, it's worth it. Number 2, walking after meals. This one's gold. Just a 10-minute walk after eating can help flatten blood sugar curves, reduce insulin spikes, and aid digestion. And personally, it became one of my favorite times to connect with my wife. We use it to talk, check in, and just enjoy each other's company. Health plus relationship therapy in one walk. I'm in. Number 3, electrolytes on keto. TikTok nailed this one. When you drop carbs, you lose water. And with it goes sodium, potassium, and magnesium. If you're low carb, keto, or carnivore like me, electrolytes may not be optional, but may be essential depending on the individual. Number 4, mouth taping. Mouth taping during sleep might sound like a kidnapping plot, but it promotes nasal breathing, which can support better oxygenation and sleeping. Just don't try it if you've got untreated sleep apnea. This hack works, but like everything else, it has to be used wisely. Now let's talk about some hacks you should be more cautious of. Number 1, internal shower. Chia plus lemon water. TikTok says this combo cleanses your gut, but you're not a sink. Now for those of you who seem to benefit from fiber in your diet and you feel it helps with your digestion, be my guest. But for me, I don't need a shower scrubbing my colon and the bloating that comes with it. Number 2, chlorophyll water. Claims include clear skin, better body odor, and weight loss. Look, chlorophyll has antioxidants, sure. And if you're not a carnivore like myself, greens can be low carb and metabolically friendly. But will it change your life? Probably not. Eat your greens if they work for you, but don't expect chlorophyll to work miracles. Number 3, dry scooping pre-workout. This one's actually dangerous. Dry scooping is when people take a scoop of pre-workout powder and swallow it dry. No water. The idea, faster absorption and a bigger buzz. The reality, it can cause choking, irregular heartbeats, and in rare cases, heart attacks. Please mix your powders. Energy should come from nourishment, not a near-death experience. Number 4, apple cider vinegar shots. TikTok says it burns belly fat. Nope. It might mildly reduce appetite and slow glucose spikes, but slamming it straight can erode your enamel and irritate your gut. If you want to try it, dilute it, but don't expect miracles. Number 5, what I eat in a day videos. Everyone's biology is different. These videos rarely mention insulin resistance, hormonal imbalances, or mental health. What works for a 22-year-old influencer may not work for you. That's why personalized medicine matters. Now let's touch on the most harmful trends I've seen. Number 1, extreme fasting challenges. Don't get me wrong, I love fasting. It's one of the most powerful tools in my clinical toolbox. But when when I see people on TikTok doing 72-hour fasts without medical supervision, especially while still on medication, I get a little nervous. If you're on blood pressure or diabetes meds, you must work with a doctor to adjust or taper them as your body heals. Extreme fasting isn't necessary for most people. Intermittent fasting, like a 16-8, is often more sustainable, safe, and effective. Number 2, DIY or do-it-yourself hormone balancing. TikTok loves seed cycling, adaptogens, and supplement stacks. And listen, if you're solving a specific problem and doing it intentionally, that's different. But don't just throw maca and ashwagandha into your blender and hope for balance. That's not healing, that's guessing. Number 3, fat burning creams and ice wraps. Nope. Just nope. You can't rub fat away. Save your money and maybe buy some grass-fed tallow instead. Number 4, eating only fruit or only meat without a plan. Here's where it gets tricky. I'm a carnivore. I eat mostly meat, but I also know that without adequate electrolytes, some people may struggle. And because of that, they drop out of this eating pattern. Not because it didn't work, but because they didn't support it right. So yes, I 100% support carnivore, but it needs to be done with intention, knowledge, and of course, support. And for some people like me, I rarely have to take electrolytes, but I do make sure my food has a lot of high quality salt added to it. So if TikTok's got you curious, that's great. Curiosity is where health journeys begin, but here's how to make it sustainable. Work with a doctor trained in metabolic health. Great places to find support, lowcarbusa.org or dietdoctor.com. They have directories to help you find clinicians who actually get it. Track your own data, labs, symptoms, energy, and how your body feels, not just your weight. Ask why something works, not just if it works. And my personal rule, if it sounds like magic, it's probably marketing. And if you've ever tried a TikTok hack that worked or totally flopped, drop it in the comments. Let's make this a space where we can laugh, learn, and grow together. And if you're tired of chasing trends and ready to learn root cause, life-changing strategies from someone who actually works with patients every day, hit that subscribe button. And remember, TikTok might be quick, but healing takes time, and you are worth that time. See you in the next video and maybe soon on TikTok.